Today, we are going to talk about polypharmacy and not just polypharmacy. I specifically want to build something around this. And so I'm going to talk about this in the framework of the seven commandments of polypharmacy and thinking specifically about something that you can implement in your own family with your own medicine cabinet or your own medicine lunchbox, whatever it is that you use in order to better manage your medications. I want to tell a quick story before I get into it because I have a neighbor who's more like a family member to me, and I use him as an example all the time just because I talk to him about his medications all the time. And he is on several different things, but he gets them from different doctors trying to streamline that right now, different pharmacies also trying to streamline that right now. Sometimes he gets a dose of a medication for a few months and then the manufacturer changes and they have to switch the dose to something else. The pill is a different dose, but the overall dose that he needs to take is the same. And so then that can get confusing. And then he's got supplements. Some of them are to treat side effects of things that are happening with the drugs. Other times it may be genuinely for overall health. But now we get into this issue of supplement stacking, and are we doing more harm than good? And so, let's talk about polypharmacy. My name is Dr. Tacoba Wallace-Gay. I'm a board-certified ambulatory care pharmacist and a professor. I teach pharmacology, and I direct interprofessional education experiences for medical students and other health profession students on the campus where I work. And every single day, my job is to take complicated information about medications and make it make sense. So my goal here for you today is to simplify medication, to simplify the process, to hand you back some confidence, to ask questions, and to walk out of your appointments feeling like you're the one that runs the show, really truly feeling like it has been patient-centered care when it comes to your medical diagnoses, as well as the non-pharmacologic and pharmacologic things that you can do for your health, because at the end of the day, you are the CEO of your own health. And so let's jump into these 7 commandments. I do have some notes and some background information that I want to share along the way. So, let's walk through it. One thing I want to clarify or make sure that everybody's on the same page about is what is polypharmacy? And so if anybody is on 5 or more medications, it doesn't matter if it is a supplement, prescribed, over the counter, if you are taking 5 or more medications consistently, that is considered polypharmacy. There are a lot of risks that come with polypharmacy. Things like increased risk of falls, increased risk of hospitalizations and adverse effects. And now, to be clear, I'm not one of those people that is like pro adding medications to people's regimens, but I'm also not like, let's just take medications away just because. I want to make sure that if you're on medications, you're on them for the right reasons and that you're using them appropriately. And there are some medical conditions or some conditions that can get worse enough that you may need multiple medications for that. And so keep that in mind. It's not always a situation where you can just come off of these medications just because you have several of them. And I've sat with many families, many patients over the years to look at their medication list and give my opinion or to give the different providers that I'm working with recommendations on where to add or take away medications. But I want to mention that there was a 2026 clinical guideline practice that included 185 recommendations. It was developed by 72 experts, and they formalized deprescribing or taking away medications in 4 different phases. 1, you have to think about when to deprescribe. 2, you have to think about the ongoing treatment needs. 3, how to deprescribe. Some medications require specific tapering, like you have to come off it bit by bit by bit in order to not have withdrawal symptoms. And then finally, you have to think about the monitoring that goes along with that. And really, I love this because this is kind of how I think about it anyway, but I really like that there's a structured approach that's come out in terms of how we do this. Now, nearly half of older emergency department patients are discharged with 1 or more new medications from the emergency department. And that's going to be something that's added on top of what they're already taking. And again, that list is just going to continue to grow and grow and grow until somebody prunes it, until somebody comes through and does an overall review of it. And I am of the belief that you should be reviewing your medications every 3 to 6 months before every doctor's appointment and during every doctor's appointment, having a conversation around all the things that you take. Now, I want to speak specifically to the dynamic in Black and Brown communities specifically. Often it's going to be a family member, and actually, I think this applies to many communities, but I'm speaking mostly to the ones that I do a lot of service with, which are typically Black and Brown communities. And it's a family member who's coordinating care across multiple different clinicians and having to bring all the medication information into one place and do that consistently. So maybe you've got a family medicine doctor, a cardiologist, endocrinologist, whatever. The list can go on. And those clinicians can't always see each other's charts. Some systems you can, but not always. And then they also are very kind of like, they don't want to mess with what the other person is doing. And so, it becomes incumbent upon you to advocate for yourself or for your family member in order to make sure that the medications are being reviewed and being managed appropriately. Now, the other thing that I want to talk about real quick before I get into the commandments is really what's at the core of medication literacy, which is what I do all of this for, is to make sure that you are more literate when it comes to your medications. So, number one, think about the why. You should be asking yourself why at least 5 times. Why this? Why this? Why this? Why this? Why this? Every medication, the patient or the caregiver should be able to say in one sentence why they are taking it. I am taking this medication for my blood pressure. Why? Because it lowers my blood pressure. Why? Because it reduces a chemical in my body that is increasing my blood pressure, or because it allows my body to get rid of more water to lower my blood pressure and more sodium to lower my blood pressure. Why? Like, you have to know why these things matter. And maybe you get to the level 3 of why and you're good with it, but it has to be more depth to it than just the number 1. Because once you know that this drug is getting sodium and water out of your body, it helps you understand the side effects better. It helps you understand interactions with other medications better. Do I have another medication that's getting rid of water and sodium as well? Now am I at a risk of having my sodium levels be too low? So 1 is the why test. Have you asked yourself why enough times that you really understand this medication? 2, the review process. And I already mentioned this, but you should be reviewing your medications every 3 to 6 months. And every single appointment, I promise you can ask any of my family medicine, family practitioner colleagues. They would love for you to bring all your medications to every visit. Not only that, they would love for you to bring all your medications, the physical bottles. A list is great, but if you can bring the physical bottles, even better. And also any logs. So are you logging your blood pressure daily or a few times a week, depending on your situation? Are you logging your blood sugar? Are you logging any symptoms that you've had since we started the new medication or changed the dose of a medication? Like, just kind of keeping track of the things that are happening. It helps the conversation flow more smoothly. It keeps you from having to remember every single detail. And it also provides some data because you are outside of the doctor's office more often than you are inside of the doctor's office. So we need to know everything that's happening when you're not at the clinic. And I say we because I'm a family medicine pharmacist, and so I'm in clinic with my colleagues, reviewing these things along with them and along with the patient. Let me adjust that a little bit. Okay. So the third thing that I'll mention is reinforcement. So you need to make sure that somebody knows everything that's happening with you. And generally speaking, that's going to be your primary care provider. There shouldn't be this situation where everybody has a little bit of a slice of the pie. Even if your family medicine clinician is not going, or your family medicine physician or nurse practitioner or PA, I don't want to leave anybody out. Even if they're not going to adjust your medication that day that the cardiologist has prescribed for you, they need to be aware of it. They need to be aware of any changes that have happened with it. And so giving them the full picture of what's going on with you is going to be impactful for you, and it's going to give them a lot more to work off of. As a pharmacist, oftentimes when I'm in clinic, if I know that my physician colleague is going to have a hard time piecing these medications together, I will call the pharmacy and figure out what has this person picked up before they get to their appointment. Try to piece this thing together for them so that we have more information, but it would be so much easier and so much more time efficient if you just brought all that stuff with you to the appointment. Okay, now let's talk about these commandments. Number one is every medication has to earn its place. If nobody can say why you're on it or what its purpose is clearly and confidently, then it might be under review for dismissal from the team. So, again, we are sometimes placed on medications, and I think PPIs are a good example. Medications used for acid reflux. You can buy them over the counter now, but they may be prescribed at a higher dose because you're having an issue with acid reflux. Well, some months go by, nobody's reviewed it. It's a lower tier medication. You're feeling great, so you don't even think to bring it up. But that medication needs to be reviewed. Why are you still on that? Do you still have an issue with acid reflux? Was it a phase? Was it something that you were eating during that time? What, have you lost some weight? Have you stopped smoking? Like, do we still need this? And do we still need it at this dose? And so we need to be clear on those things. And perhaps you can reduce the dose or remove the medication altogether. And that would save you some time down the road, specifically with PPIs, things like omeprazole, Nexium, Prilosec, because they can reduce your magnesium levels, which can have cardiovascular implications. They can also reduce absorption of different vitamins and minerals, which could have effects on your bone health. And so, yeah, those are things that we need to think about. All right. Commandment number 2, bring the whole bag, not just the list. So when I mentioned earlier to bring all your medications to your appointment, I'm talking about OTCs, prescription medications, supplements, every single thing that you take, and bring it to the appointment or bring it on a list. But again, bringing the physical bottles or containers is even better. If you're taking electrolyte supplements, even like that you're putting in your water, like we need to know about that. Um, because maybe we're seeing your sodium levels bump up and we're unsure why. And then we find out that you have some type of supplement drink every day that has electrolytes in it. So those are the things we need to know. Bring all of your medications every time, whether it's OTC, supplement, prescription, anywhere in between. Bring a topical agent, bring all that to your appointments, as well as your log sheets and all of that as well. Commandment number 3, one prescriber should own the full list, not each specialist having their own slice. And so I kind of already mentioned this as well, but you want to make sure that there is one person that knows everything that's going on with your medications. It doesn't matter who they're prescribed by or where they're coming from. One person that knows everything. Number 4, if you have a new symptom, ask yourself or ask your physician, could this be the drug or is this something to do with the medical condition itself? Because oftentimes we'll add another prescription when really all we need to do is calm down on the dose of a certain medication or switch that medication to something in a different class so that you still get the clinical benefit without that particular side effect. So you need to find out, is it the drug or is it the actual medical condition not being controlled? Sometimes it's the withdrawal of the drug that has caused the symptom. So there are some medications that if you're missing doses and you're not taking it like you're supposed to, you could have some rebound effects that make it seem like your medical condition has worsened, when in fact, you just need to take the medication the way that it's prescribed. So ask yourself, is it the drug? Is it the disease? What's going on? OTCs and supplements count as medications too, y'all. A lot of times we just kind of overlook those, like that's not a big deal. I'm just taking a multivitamin and it's great. We love that for you. We want you to take your multivitamin, but also it is a real medication. And so we need to know about it. So all of those things need to be accounted for. That random thing that you saw on Instagram that somebody was selling and has promised great benefits for whatever the case may be, you need to bring that too. Like we need to know about all of that so we can actually look at the ingredients and see, is there anything within this product? Because those things will have like 10, 15 ingredients in it. So we want to know if there's anything in there that could be interacting with your medications. Deprescribing is a taper, not a stop. So a lot of medications that you're on require us to come off of them gradually, not just quitting them cold turkey. Now, there are some medications that you can quit cold turkey, but you shouldn't have to remember that. So if for some reason you need to come off of a drug or you want to come off of a medication, have that conversation with your provider, because there is a safe way to do that that does not rebound your issues or cause you to have additional effects. And then the 7th commandment of polypharmacy is every single refill is a checkpoint for you. Every doctor's visit is a checkpoint for you to think about, does this medication still make sense for me? Is this something that I still need? And you might be on certain things like a blood thinner, a blood thinner, because you have atrial fibrillation. And so, yeah, you may ask yourself that question every time, and the answer is going to be yes, pretty much every time, because we're trying to prevent you from having a clot and you've got a medical condition that's chronic. But that's not always the case. So you have to ask the question, figure out if it's something that you still need, and go from there. All right, y'all. So those are the 7 commandments of polypharmacy. 1, if you're on 5 or more medications, really, if you're on any medications, you need to check often, but 5 or more medications for sure. Know what the medications are for. Ask yourself the whys and think through those 7 commandments and follow them. It's going to help you out. It's going to make you feel more informed, more empowered, but it's also going to help your physician and your healthcare team out because they are going to know a lot more information about you, and that's going to allow them to make better decisions on your behalf. But you're going to understand those decisions as well because you will have asked all the questions.